Good afternoon, everyone. Let me start with a trivia question. Which industry contributes to the maximum data volumes that's being generated? Any guesses? Yeah, I thought media as well, but it's healthcare industry. The healthcare industry contributes nearly 30% of the data that's actually being generated across all sectors. So Roche is a global leader in healthcare. We are one of the largest biotech companies and leading supplier of in vitro diagnostics. Ultimately, what we are striving for is advancing science so that we all have more time with the people we love. Data is not new for the healthcare industry. It has always been there, and it's gaining significant importance over the years. Data is instrumental from the drug discovery to development and up to the point of care for patients. The focus on data has enabled us to deliver more innovative and life-saving medicines and solutions to patients all across the globe. Before I go into the details of data and technology and how we are actually leveraging that, I wanted to take a moment to set the stage. In the broader context, right, the demands on the healthcare systems are changing dramatically. To start with, what does this actually mean for us? One is we have an aging population. Two, we do know that the healthcare resources are continued to be stretched. The recent pandemic has been a great example. And three, our needs as patients is evolving as well. What I find extremely fascinating is that we as patients, we have far much more increased awareness, and we are empowered to understand our diseases, our healthcare conditions, and actually manage it in a much better way. By 2025, it is expected that the annual growth rate of data for healthcare alone will reach 36%. This is by far, it's faster than manufacturing, which is at 6%. It's faster than media, which is at 11%. In this wealth of data is the potential for greater data-driven innovation in medicine and personalized healthcare. Data is central at every stage of the value chain, from the early discovery to the point of care. For us, in order to be able to truly generate insights, to understand the unmet needs, we need to be able to look at data across the value chain. Only 5% of the data is coming from the randomized clinical trials. The 95% of data sits in the real-world setting. The challenge, though, is that the real-world data is highly unstructured. It's in every format: images, audio messages, videos, pictures, and to transform unstructured data into structured data where the key insights sit is extremely challenging for us. The majority of healthcare and research data is unstructured, which, as with any other unstructured data, imposes challenges from transforming it to integrating to processing, compute, and so on. So it is essential for our data ecosystem that we establish this in a highly connected way, and it's collaborative, that we are able to build and share the insights that we create. And this is only possible by introducing data as a product thinking in the large organizations. Next, I want to share with you a use case that actually demonstrates the ways in which we are, is the slide moving? Oh, yeah. Next, I want to share with you the use case that demonstrates the way we are actually leveraging data across the value chain. I'm sure all of us sitting here, we've been at some point in a hospital at the emergency setting. I was there a couple years ago with my daughter when she broke her arm, and she had to wait literally 4 to 5 hours on a Saturday evening to get the x-ray done. What we know is the healthcare professionals at these hospitals are clearly at stretch. And it is estimated that every healthcare professional invests nearly 40 to 50% of their time in purely data management activities. That's literally 4 to 5 hours of their day. if we are able to shift these efforts towards easing their burden of doing the data management activities and automating it, we will be in a much better position to support them to be with patients much more. So go-to-market is a domain. It's more towards the tail end of the value chain that you saw previously, which enables Roche to understand our customers and patients, our healthcare professionals, so that we can deliver the services across the healthcare system. But for us to start introducing data product thinking into the go-to-market domain, we did have challenges as well. We did have technology constraints, so we have a lot of legacy systems. We did have skill set and expertise challenges, and we did have also the thinking of data product centricity was hard. But we also did see an opportunity there, and we wanted to create that impact for us to actually understand our stakeholders, leverage the insights that we actually get from the unstructured data that we have. So what we did is we took this challenge on. We brought in we integrated 40+ different data sources, which had unstructured, semi-structured, structured data. It had more than 100 terabytes of data in it, more than 3,000 daily ingestions. And what we built is an architecture and an ecosystem enabled by technology that will actually help us to drive insights through AI and MLOps. Ultimately, what does this mean? We did leverage technology, but ultimately what this means is we reduce the burden of information gathering and management for our healthcare professionals so that they have much more time for patient care. There's a lot on this slide. It's slightly crowded, but I would like to break this down on how we've actually leveraged technology to bring data as a product. We have the imperative and the bold ambition to deliver the best experience, a seamless integrated experience for our data scientists, analysts, and the business users who are actually using these insights to engage with their customers and patients. Technically speaking, what we wanted to do in very simple terms is to leverage AI and MLOps to have a recommendation system, if I may say, to predict timely, targeted, and personalized insights for us in the organization to be able to create a seamless experience and engagement with our stakeholders. But for us to be able to do that, the architecture is great. And as Andy was mentioning, oftentimes when we start with implementing a new platform, we start with the analytics. We start with the cool stuff, which is the AI, ML. What we often forget is the data foundations. So we invested heavily on the data foundations, which you see pretty much on the center of that slide. The key to this for us was to start looking at how do we actually manage the data. So what are the data management capabilities that's required? Master data, reference data, terminology management. For us to actually have all of these data, we needed a solid store. And here I would say thanks to S3 that has enabled us to create that unified data layer where we are able to put all of this data that we get from the 40 different sources, the ingestions, and actually build that layer, which is further integrated with our analytics tool. The entire foundation, I would say, from my experience, has been built on master data, metadata, stores, compute, and cataloging, right? And what's worked very well for us is S3 is so seamlessly integrated to the rest of the ecosystem of technology. It makes it also easier for us in terms of scalability and in terms of actually convenience and cost effectiveness as well. So through this experience of working with enterprise data across Roche, I have come away with few key takeaways. What you saw on the previous slide, the highest level of architecture, it has taken us 4 to 5 years to actually come to that. So what I would like to share back with this audience is some of the learnings that we've had that hopefully we knew 4 years ago. One is invest in strong data foundations. We need to make sure that we have the architecture, data lineage is critical, and how do we make sure that we are establishing that from the source to the consumer? That is required. Here we need the cataloging and the S3 capabilities, and the metadata governance is extremely important. So invest and ensure that you have strong data foundations. Second, people. Invest in the people. It's people who create the insights and the meaning from the data. So make sure that we have the right skill set, and we are upskilling the colleagues that we have within the organization who are able to leverage the new technologies and actually bring that into the ecosystem. And third, and I would say one of the most important, is radically simplify. In large organizations, we often have the tendency to retain legacy and to build new. So when we are building new platforms, ensure that we are actually replacing legacy. And also when we look from an architectural perspective, make sure that we have a very simplified architecture which enables us to scale. Technology is evolving at a rapid pace, so we cannot create a monolith platform that cannot have replacement of technology as it grows. So radically simplify. With the increasing quantities of data and data types, we will need to invest far much more in integration and processing capabilities as well. So before I hand it back to Andy, what I wanted to pass the message over here is, in the healthcare industry, we are here to serve our patients. We use technology as a key enabler of data with which we drive and are able to drive outcomes for our patients so that we all have more time with the people we love. Thank you.